Undocumented Latino immigrants are at a higher risk of experiencing mental health issues compared to those with documentation. Nevertheless, formal mental health service utilization rates are significantly negligible within this demographic. The lack of health insurance, financial hardships, fear of deportation, and inadequate mental health services only further exacerbate the plight of undocumented Latino immigrants. There's a real need for more accepting and non judgmental settings where undocumented Latino immigrants can obtain fitting mental health care. Undocumented Latino immigrants need to be seen for who they are and addressed for the issues they are facing. A heightened anxiety and adverse mental health outcomes are often felt by undocumented Latino immigrants, which is created by a growing anti immigrant social environment. Chronic stress experienced stems from restrictive immigration policies, anti immigrant rhetoric in the media, and by political leaders. Fear of deportation, discriminatory events, concealment, and internalized anti immigrant sentiment. The identity can be an essential effect modifier in the stress process. Social isolation in the immigrant community has heightened the impact of stress and impeded coping strategies. These stressors have resulted in distrust in community resources, uncertainty about future health benefits, delayed medical care, and adverse mental health outcomes. These findings provide a framework for understanding the unique stressors experienced by immigrants and highlight the need for developing effective strategies for interventions by social service agencies and practitioners. In the United States, members of historically oppressed populations, such as racial, ethnic, and sexual minorities, experience a greater prevalence of adverse mental health disorders and less access to services compared to more privileged groups. Cook et al. 2019. An established body of research has found that the most significant burden of mental illness in the United States falls on ethnic and racial minority groups. Cabral Smith, 2011. Furthermore, it was found that significant disparities in mental health care for Latinos were significantly less likely to access mental health services than U.S. born Latinos and in general, U.S. population. Lopez Barrio Coppolis Vive, 2012. There's significant disparities in mental health service utilization between native born and foreign born individuals. Non citizens face greater challenges in accessing these services due to their unfamiliarity with the U.S. mental health system, limited English proficiency, increased financial stress, and ineligibility for insurance. Yellow Matejoski, 2012. Immigrants' exposure to stressful conditions, such as discrimination, increases the risk of negative mental health outcomes and is linked to the duration of residence in the United States and the loss of contact with essential social networks. Breyer et al. 2015. Although several studies have cited discrimination as a primary source of stress for immigrants, Latino immigrants consistently report more discrimination than U.S. born Latinos, given that the latter are socialized in the United States and thus are more likely to understand and perceive discrimination in the U.S. Context of Breyer et al. 2015. Heightened anti immigrant rhetoric and immigration enforcement have increased perceived discrimination among Latino immigrants and placed them at risk for adverse health outcomes, particularly among undocumented immigrants. Some of the main factors that have been found to shape immigrants' health and well-being negatively include in post-migration trauma, acculturation, anxiety related to job insecurity, and the strains of low-wage work, and discrimination. Giles et al. 2013. Immigrants also face stressful post-migration circumstances such as family separation, cultural and linguistic barriers, and adjustment to a new and sometimes unwelcoming environment. There, 2015. Acculturation studies have served as the predominant framework for understanding Latino mental health research. Estreros S. N. Wallace, 2013. Acculturation highlights important aspects of how individuals make meaning of their life experiences through language, cultural norms, and values. Abayanyani Seward. Takuchi Mkangan. The influence of acculturation with undocumented Latino immigrants often leads to cultural and familial conflict. which can conceivably have an adverse mental health impact as well. Past studies on Latino mental health have often demonstrated that the influence of acculturation within immigrant families has often led to cultural and familial conflict, which may have a contributory adverse effect on mental health. Acculturative stress does not account for the circumstances of departure from the original country, which political conflict, economic conditions, gang violence, or other traumatic events may have caused. Additionally, structural issues that uniquely induce stress among undocumented immigrants can include the inability to vote, obtaining a driver's license, and not qualifying for most types of jobs, sector in ESL. 2015, along with the daily fear of immigration enforcement that shapes movements within one's community of peace. More recently, worsened living conditions for Latino immigrants have affected the long-term mental health of undocumented immigrants and members of mixed status families, experiencing helplessness and daily fears of deportation. Head alone 2019. Rajas Flores, Clements, Wang Ku, London, 2017. Stress is a function of social systems that structurally promote discrimination and stigmatization of minority populations. Meyer, Schwartz, Frost. Individuals with minority identity experience stress at greater and more frequent levels, with processes such as discrimination and prejudice mediating the relationship between minority status and stress. Woodford, Hahn, Craig, Lim, M. Matney, 2014. Various studies have assessed the relationship between perceived experiences of discrimination, internalized prejudice, and fear regarding stigmatization with psychological distress, substance misuse, and suicidal ideation among undocumented Latino immigrants. Brewster, Morati de Blair, SM, 2013. General stressors are those that can be experienced by all individuals and are not directly related to minority status. Stressors that were identified in the interviews with frontline providers and Latino immigrants included divorce, family separation, disability status and inability to work, health status, being underinsured, getting scammed or robbed, financial difficulties, lack of social support, driving, family problems, parenting, navigating, and paying for healthcare, among others. Given that these stressors are not necessarily unique to this population, though their minority identity may exacerbate, general stresses of undocumented Latino immigrants can also mean getting scammed or robbed, experiencing financial difficulties, lacking social support systems, experiencing family problems, as well as parenting issues with siblings, and difficulty navigating and or trying to pay for healthcare needs. Prejudice events are those events that happen to individuals based on their minority identity and are discriminatory. These can be events related to prejudice, violence, or mistreatment of individuals based on their belonging to a particular population. Research has revealed that individuals are likely to have had firsthand experience of discriminatory events against themselves or their close relatives. Moreover, instances of prejudice and discrimination affecting undocumented Latino immigrants occurred on multiple levels. At the first level, there were firsthand experiences that were primarily based on race and ethnicity, as well as assumptions about citizenship status. Those who had gone through firsthand experiences with prejudice events found them in their everyday life, for example, while seeking medical care and social services, in workplace settings, among other settings. These events included racial profiling by the police or immigration enforcement, identification inquiries by non-government officials, detention and deportation, and being singled out because of Spanish usage. Although firsthand experiences with discrimination because of race, language, or immigration status were voiced by many immigrant clients, instances of interaction with law enforcement and ICE represented the most stress. While most clients experienced fear and stress associated with possible encounters with law enforcement and immigration, those who had previous detentions or deportations exhibited greater signs of stress and trauma. It is important to note that varying levels of perceived discrimination among different subsets of the undocumented Latino immigrant population appear to exist. For example, those who were younger had darker skin, communicated in Spanish, and half those who had children were more likely to recount experiences of discrimination than other members of the population. Moreover, discriminatory and prejudiced experiences were a significant source of stress for this population. While events such as ICE raids and discriminatory events in the community, negative immigration media coverage, and anti-immigrant rhetoric by political leaders did not directly affect all individuals, they represented a source of stress for Latino immigrants, influenced behavior, and generated persistent fear. Instances of discrimination are interpreted as prejudicial events by immigrant clients. Given the amount of fear and stress generated in immigrant communities by the anti-immigrant rhetoric heard in popular media outlets and the instances of discrimination portrayed in the media that other members of the Latino immigrant community experienced, many undocumented immigrants echoed the strong role of the media in fortifying fear and stress among immigrants on multiple levels of discrimination in the immigrant experience. Prejudice events at different levels generate fear of deportation and result in behavioral changes. With many immigrants reporting delays in medical care, social isolation, and lack of social support, ceasing use of welfare benefit programs like WICs or Medicaid, and plans to return to their country of origin, individuals belonging to minority populations often develop expectations of rejection by others due to their minority characteristics. As a result, members of minority groups expect to be rejected and stigmatized in social interactions or for prejudiced events to occur to them. Latino immigrants experienced expectations of rejection through social interactions when seeking or not seeking services and with potential encounters with law enforcement or ICE. It was evident that undocumented Latino immigrants were afraid of engagements with law enforcement or ICE because they suspected that it would lead to detention or deportation. Expectations of deportation are a unique expectation of rejection experienced by undocumented immigrants, which is the result of their legal residency status, anti-immigrant rhetoric, the current political climate, and pervasive concerns with being sent to their countries of origin and what that would entail. Living with constant anxiety and fear of deportation has caused several immigrants to expect inevitable deportation, leading some to plan. As a response to prejudice events and expectations of rejection, members of minority groups often take steps to conceal their minority identity to avoid stigma, discrimination, and experiencing violence. Undocumented Latino immigrants often take measures to conceal their identity on an everyday basis to avoid stigma, discrimination, and the fear of deportation. Once individuals learned of the apprehension circumstances experienced by others in their community, they adjusted their behavior to avoid compromising situations for themselves. Concealment has also affected the healthcare delivery sector, with providers reporting a drop in clients seeking services as they learned that clients were missing or rescheduling appointments due to the risk associated with driving without a license. Knowledge of cases where police officers called ICE led many to associate driving with a risk of being pulled over by police and being asked for documentation. Concealment limits healthcare access and also hinders positive mental health adjustment, limiting social isolation and support systems in many immigrant clients. Moreover, a decrease in social activities and gatherings among the Latino community often corresponds to anti-immigrant political rhetoric in the media. Coping and social support encompass the various mechanisms utilized by members of minority groups to cope with the unique stressors they experience and the general support they receive. These factors modify the relationship between stressors and mental health outcomes among minority groups to the benefit or detriment of their outcomes. Often, undocumented Latino immigrants would find social support and coping primarily through their family and their religious beliefs. However, due to their citizenship status, they would also seek support from legal services when available, the immigrant community, and occasionally healthcare providers as well. The most significant source of stress was the potential for family separation, especially for families with younger children. To properly address mental health disparities among undocumented Latino communities, behavioral health interventions should consider sources of stress from discriminatory events, expectations of rejection, and how concealment is used as a defense mechanism. Addressing concealment is particularly important in the healthcare delivery process as it can further limit access to healthcare for hard to reach populations. Practitioners and researchers can further consider the medical and behavioral health services for this population to improve health outcomes. Thank you.